It's great to be going to listen from Jeff, the academic copy editor. We are going to discuss the pandemic COVID-19 in more detail and how the elderly fared during the pandemic and how the different societies, whether they were in the West or in the East, reacted to the pandemic. Jeff, could you please introduce yourself and what do you do for business?
Yeah, I'm Jeff Melton. I'm a social psychologist here in the United States. I'm in Bloomington, Indiana. And I did my PhD work at University of Illinois quite a while back and kind of bounced around to different adjunct or visiting faculty positions for quite a while. And eventually I decided to exit from that and do something else. So now I edit journal articles and books and so forth, typically from psychologists, but not necessarily confined to that. Sometimes sociology, sometimes other things. Just recently edited a book for a guy on why we should eat a plant-based diet and be healthier. So you can do all kinds of things. But anyway, so because my teaching load was so heavy for all that time, I've been kind of out of the research game for a while, but my colleague Bob Sinclair, who's a social psychologist in Canada, and I keep in touch, and he started getting interested in doing research on the psychological or social aspects of COVID. And so we hooked up about a couple of months ago to do this study that I'm going to be talking about today.
Amazing. What was the study about?
Basically about the relationship between culture and death rates from COVID-19. And more specifically, we looked at a cultural dimension called collectivism versus individualism and found that, as we predicted, collectivist countries have lower death rates on average from COVID.
What are collectivist and individualistic communities or cultures?
Yeah, so a collectivist community or country is very sort of group-oriented. Their goals and values are oriented toward serving the interests of whoever they regard as part of their community, whether it be their family or their neighborhoods or their country, etc. And individualistic countries or whatever entity you want to talk about are oriented toward their own particular interests and needs, more so than the group, which is not to say that it's either or, but just a matter of emphasis. In individualistic societies, you're more likely to have people, or at least we predict, for example, ignore laws of the government that are designed to protect your health in this case.
Okay, could you give us examples of communities which belong to either side?
Sure. So countries that are more collectivist examples are countries in Latin America, East Asia, Africa, and they tend to be countries that are less developed or that used to be. So they've had to depend on each other for survival, perhaps more than the more affluent countries. So examples of individualistic countries would be like the United States and Canada and Western Europe and Australia, New Zealand, etc.
How did the two types of cultures react to the pandemic?
What we found was, the overarching finding, of course, was that they had much lower death rates from COVID. And as you probably are aware, a very large share of deaths from COVID are elderly people, and as well people who are in nursing homes where they are more kind of living in closer quarters, so they're more likely to infect each other. And collectivist countries tend not to have as many elderly people in nursing homes. They're more likely, and that's not to say that most elderly people, at least if they're not very disabled, don't live on their own in individualistic countries, but they're much less likely to put their elderly in nursing homes. The collectivist countries are. And so we looked at things like when countries implemented mask mandates, and we looked at when countries locked down, and we found, for example, that more collectivist-oriented countries tended to implement mask mandates significantly earlier than individualistic countries, and same with lockdowns. And we think, though, that because the effect is still there when we partial out, mask mandate or lockdown dates. We think that there's some variance there in terms of the behavior of individuals who, regardless of what their government tells them or what regulations their government implements to protect health, they're more likely to take actions on their own to protect each other. So, for example, in Hong Kong, because of the protests that have been occurring there over the past year, the government actually had a ban on people wearing masks, even though that was kind of part of their culture due to experiences with past pandemics. The government of Hong Kong actually had a ban on masks, and yet within, I think it was like a month of learning about the cases in China, something like over 90% of people in Hong Kong were wearing masks on a regular basis when they went out. My colleague, Mark Bogdanovich, who is my business partner in the editing firm, lives in Hong Kong, and he says that the only people he has encountered not wearing masks in Hong Kong are Americans. So,
oh yeah.
So yeah.
Yeah. And how was the death per million average different?
I think it was about, if you just do a median split on the data, so above 50, individualistic countries, below 50, collectivist countries, about 80 in collectivist countries, and about 220, I think, in individualistic countries, the median death per million rates. So,
how were the circumstances different for the elderly living in the two types of communities?
How were what different? I lost you for a minute.
Yeah. How were the circumstances different for the elderly in both types of cultures?
Well, I mean, there are a lot of differences between countries in each group, in terms of what type of government they have and so forth. So, for example, we found countries like Brazil or Peru, which have very right-leaning, pro-business governments, had high death per million rates despite being collectivist. And on the other hand, some of the individualistic countries like New Zealand had very responsible political leadership. But just in general, in the collectivist countries, you wouldn't be as likely to find people, for example, protesting against a mask mandate, whereas all the time you hear about places in the United States where people are like going into a Target store, without a mask and yelling at people to take off their masks, and this is all fake, and so on and so forth. And you hear all these crazy conspiracy countries and conspiracy theories in a lot of Western countries about the pandemic, and you just don't get that, as far as I can tell, from the more collectivist countries.
Why were differences in the numbers between the collectivist communities and the individualistic communities in the deaths per million rates and in the elderly especially? Why were these main differences?
Why were there such differences?
Yeah.
Well, I mean, it's hard to pin down for sure, but as I said, we found differences in the date of implementation of mass mandates between the collectivist and individualistic countries. Tended to be sooner in the collectivist countries, closer to when they had their first reported case, and same with lockdowns. But those are not huge effects, so there appear to be other factors involved. We don't have enough data to really, make a strong case for differences in nursing home, populations. Most of the data we found were for the individualistic countries, whereas overall there are a lot more collectivists in individualistic countries. But certainly the data do suggest that that's a difference that the cultural difference might explain. And of course we centered our paper around that idea. Even though we at this point don't have the data to conclusively say that's the main thing driving this, because I mean, obviously the vast majority of deaths from COVID are in the elderly population. But we need to figure out a way to get more data on this, but it appears that a lot of the variance in death rates has to do with the behavior of individuals who are more likely to socially distance and sanitize their hands and wear masks in the more collectivist countries. And I think it's not as if like everybody in the United States is being irresponsible about this or something. As the pandemic has gone on, more and more people have been wearing masks and reporting other behaviors to protect themselves. But it's a matter of degree. Even though most people are taking measures to protect themselves, you've got a few outliers there who are doing things like congregated in the hundreds of thousands, descending on a small town in South Dakota for a motorcycle rally. Hundreds of thousands of people in this town with a population of like 10,000. And then they disperse all over the country. They came from all over the country. And I read a study or summary of a study that found that 250,000 cases were traceable to this one event. So like, a tenth of the cases, new cases that occurred, or new reported cases that occurred, within like a month or two time span. Now I should mention, I made sure to clarify reported cases because one of the points that Bob's made in his past research is we really have no idea, how many actual cases there are. Epidemiologists can make estimates, but if you look at how samples are gathered, whether it be for testing or for antibody studies, they're not doing everything they need to do to get a representative sample. So obviously, typically people who get tested for COVID are people who suspect they have it or that they have been exposed to it, or they're just paranoid or whatever. And similarly, there are biases in samples for antibody studies. So really, the only way that we would be able to know what the infection rate is in a population is if we did random sample testing, and that's, I don't know of any country that's done that. I know there are organizations that have done that. For example, the university here in my hometown, Indiana University Bloomington, is doing random sample testing after having initially tested all of the students when they came back for the fall semester. But that's very rare. So that's why we are centering our research on death per million, deaths per million, because even though obviously we don't know exactly how accurate that number is, it's bound to be more accurate than estimates of numbers of cases.
Let's move to another area. What are the implications for reopening schools?
Well, I guess the implications are that if you live in an individualistic country, I mean, there's more likely to be people who are being reckless about things. So whether it be reopening schools or reopening businesses or what have you, you have a higher number of people who are either not going to wear a mask, or they'll take their mask off when they shouldn't, and you're not socially distancing 2 meters or more, or what have you. And so obviously people will say, oh, well, they're just kids, they're unlikely to get very sick from it, let alone die. And while that's true, obviously they can spread the disease to people who are more vulnerable, including certainly the large number of American kids who are overweight substantially, and so forth. And so, whatever their risk factors are, there are certainly children who are at high risk too. So we have to be very careful and think about things like, well, should we have in-person classes? And if we do, should we limit the number of students? And I don't know if we're going to keep this discussion in the final version of the paper, but we talk in the paper about ideas for limiting the spread, like having half of the kids go in the morning and half in the afternoon, or having some in the classroom and some on the playground, and things of that nature. But certainly there needs to be a decent testing and contact tracing program in place in order for that to not get out of hand. And I don't know how many schools are doing that.
Oh yeah, that's quite difficult. What are the implications for reopening the economy?
Well, basically the same thing. And this is true not just in individualistic countries, but in countries where the government is more sort of captured by wealthy interests. They're going to push people to go back to work in risky situations. For example, there are a huge number of cases in Peru among coal miners where they're kind of packed together, or not coal miners, but miners in general. They're packed together underground and not able to protect themselves so well, and that's one of the reasons why Peru has such a high case rate. And here in the United States, you find a lot of cases among factory workers or slaughterhouse workers, other people who are not able to socially distance very well when they're on the job. And they may be working for a company like Amazon, for example, that has been pretty lax at times about taking precautions, and so people have died on the job from that, or spread the disease. And obviously, any circumstance where a lot of people are close together indoors, like bars or whatnot, or parties indoors, are high risk situations typically. And in a country like ours, the government has not done enough to protect small business owners. So a local restaurant here in town that we really liked had to sell their business because they couldn't get sufficient aid from the government to keep themselves afloat while the pandemic was going on. And that's true of tens of thousands of small businesses in the United States. So it's like you feel compelled to go back to work, but then if you do, and customers are coming in and out all the time, then it's a risky situation.
Yes, it is. What else would you like to say?
Well, we are going to continue this line of research and try to get at some of the more individual sorts of factors in future work. What we've done so far is just hit upon some of the things that was easiest to collect data on in terms of things that might differentiate collectivist and individualistic countries, which you can pretty easily look up data on government policies. So that's what we've done in this study, as well as the collectivism, individualism data. Yeah, we're just gonna do more work to try and pin down exactly what the behavioral differences are that are accounting for this pattern that we found. And we also want to see if we can pinpoint a little better what the reason for exceptions to the rule is. So what exactly has New Zealand done, or Slovakia or wherever, that have very low rates of COVID death, and why is a country that's more individual oriented, why are they willing to take that action? And on the other hand, you have countries like Brazil, where they didn't propose a mass mandate in the legislature until I think it was early July, and then the President Bolsonaro vetoed it, and they finally got one passed like the next month. And that's one of the reasons why Brazil has a very high case rate, despite being a very collectivist-oriented culture. So yeah, we're going to try to focus more on the exceptions to the rule, which we do talk about, as you saw in this paper. But we need to get more data.
Yeah, it has been more than amazing talking to you, Jeff, and getting these important pieces of information about the pandemic and how the elderly are important, and the important to take care of them. I really appreciate your great input and time, Jeff. Thank you.
Yeah, and I can give you a link to at least the current draft of the paper that people can click on and read over. And also, I just want to plug our business, oceaneditors.com. We do all kinds of academic editing. We do consulting on research methodology and so forth as well. So if you need a sharp pair of eyes and somebody with an academic background to help you get that next paper published, please look us up.
Yeah. Thank you, Jeff.
Thanks a lot, Nour.